Hi, I'm Dr. Greg Castello, board certified family practice with CastelloWellness.com, and we're going to do part 2 of our 3-part series on regenerative medicine today and talk about PRP therapy. PRP is platelet rich plasma, which we inject into your damaged ligaments or tendons or injured joints. We know platelets' main job is to stop bleeding. So if you cut or tear or injure yourself and start to bleed, the platelets are summoned to the area. They actually stick and aggregate and clump, and they cause the clotting process and stop you bleeding. The interesting thing about platelets is that they are full of growth factors. There's at least 7 different growth factors identified in platelet cells that are released in the area to start the healing process. And this is an amazing engineering feat that we have something that is brought to very specifically a site of injury where you damage tissue. These platelets bring with them growth factors, and the platelets, after they stop bleeding, will start to dissolve, and they release growth factor in the area, and all of the healing processes started with these growth factors. The way we do it in the office is we draw your blood, about 2 ounces of blood from your vein, like a regular blood draw, and we spin it in a centrifuge and separate the red blood cells down at the bottom, and the top portion is a yellowy, watery solution called plasma. Within this plasma is the platelet cells. We take a second spin in the centrifuge, and we now push all the platelets down to the bottom, and we separate about 5 cc's or 1 teaspoon of platelet-rich plasma, which is what we use to inject. So we want as many platelets as we can in a small volume because we're going to be injecting that into you to cause healing. So we can inject PRP pretty much anywhere. It's great for ligament and tendon injuries. We don't like cortisone shots into ligaments and tendons because they can actually soften the ligaments and increase your risk of tearing in the future. So the more times we give you cortisone, the greater your risk of rupturing a tendon or ligament, and that's devastating. It creates a repair process around that ligament or tendon. We can do it into muscle. We do it into your joint. Say if you've got torn cartilage in your knee, or even if you have a bulging disc, we can put PRP at the site of injury, and this induces the healing process. So different than prolotherapy. Prolotherapy is more a generalized injury and repair process, good for strengthening and tightening up the tissues. PRP is a more concentrated, very specific growth factor stimulating process to induce healing. Part 3, we're going to talk about the ultimate, and that is stem cell therapy, where we actually inject stem cells into the area to induce actually making brand new cartilage, ligament, muscle, or tendon. Dr. Greg Castello, thanks.